This is an important question. The paper deals with the issue of anastomotic leakage after low anterior resection for rectal cancer, a complication that all of us as surgeons are always very careful and worry about. This paper worries me for several reasons. To begin with, the way the authors have gone about assembling the sample. From a large database of around 1,000 patients in Japan, they have used a very sophisticated technique of extracting comparable groups. The best I could understand it was that this was something in the nature of what we would call a case control study. And what they have done is they have extracted two equal-sized groups of about 165 patients each, one of whom had a proximal stoma and the other group did not. When you look at the paper itself, what the authors have come up with is the fact that it makes no difference whether you had a stoma or you didn't have a stoma. It makes no difference. The number of patients who are going to leak are about the same. What they did point out was that when it came to a question of patients who had severe complications, that is, those who needed a repeat exploration to control the leak, the incidence was much less in patients who had a stoma than in those who did not. Now, what's new about this? We have known this for decades. The authors have really done nothing except go through a lot of time and trouble to tell us nothing of real value. And they have done it in a poor fashion. The way they've extracted the data is highly questionable. This is an interventional study, and this kind of retrospective manipulation of groups from a large population is never considered to be scientifically valid. At the end of the day, they have told us nothing new. They have gone back and reiterated what we've all known for a long time. They still don't answer the question of whether you should or should not create a stoma in all patients who want to go away. Low anterior resection, I think the consensus today would be most of us would not do it. For all these reasons, this is a poor paper and it doesn't carry much value or merit.